PTSD is a clinically significant condition with symptoms continuing more than 1 month after exposure to a trauma that has caused significant distress or impairment in social, occupational, or other important areas of functioning. Patients with PTSD may exhibit persistent re-experiencing of the traumatic events, persistent avoidance of stimuli associated with the trauma, numbing of general responsiveness, increased arousal not present before the trauma. PTSD can also have a delayed onset, which is described as a clinically significant presentation of symptoms causing significant distress or impairment in social, occupational, or other important areas of functioning at least 6 months after exposure to the trauma.
These symptoms involve relieving the event through nightmares or triggers. The second symptom is avoiding situations that remind you of the event. The third symptom is having negative changes in beliefs and feelings. The fourth one is feeling hyper or jittery, so making it hard for you to sleep or concentrate.
Post-traumatic stress disorder is clinically significant to nursing students across America. Since the war in Iraq started in 2003 and the continuing war in Afghanistan, 2.7 million Americans have served. These service members have been diagnosed with over 333,000 cases of traumatic brain injury, but only 138,000 have been diagnosed with post-traumatic stress disorder.
There's a basic yes-no 4-question questionnaire called the PC-PTSD that nurses can easily ask a patient before an appointment to assess whether they might need a referral. Answering yes to 3 out of the 4 questions is considered a positive test, and the nurse should inform the provider. In your life, have you ever had an experience that was so frightening, horrible, or upsetting that in the past month you 1. Have had nightmares about it or thought about it when you did not want to, 2. Tried hard not to think about it or went out of your way to avoid situations that reminded you of it, 3. Were constantly on guard, watchful, or easily startled, and 4. Felt numb or detached from others, activities, or your surroundings. So what brings you in today?
Since I got back from deployment, I haven't been feeling myself.
So can you explain to me what you mean by you haven't been feeling yourself?
I'm just not happy. I don't really want to do anything or go anywhere. I'm irritable and anxious and can't sleep.
Is there any event during your deployment that you think about more than others?
My convoy was ambushed and we lost one of our guys.
Do you have times during the day when you relive the event?
I do. I know it's not happening, but I get the same feeling all over again.
When you're reminded of the event, do you get fearful or anxious?
My heart beats really fast. It takes me a minute to calm down.
Do you have nightmares or think about the event when you don't want to?
Yeah, I have nightmares, which is why I can't fall asleep. And when I do finally fall asleep, I have dreams about being back in Iraq.
Since the event, do you avoid certain places, situations, or people?
I don't like crowded places. My husband made me go to the mall with him, and I was on edge the entire time.
Do you feel less connected to your family or friends?
I'm just tired a lot, so I don't really want to see anyone, and it makes me irritable towards people.
Have others noticed this?
My husband thinks I'm not myself anymore. I'm not the same outgoing person as I was before.
Since the event, are there things you used to enjoy doing that you no longer do?
I used to be a real outgoing person.
Have your life goals or plans changed since you've come home?
I don't really have any plans or goals.
Since you've been home, do you find yourself angrier, more prone to arguments, or even violent?
I'm easily irritated and frustrated with people. I'm not violent, though.
Before your tour, did you have trouble sleeping?
I didn't have any trouble falling asleep or anything. I just can't sleep now.
Do you find yourself being startled at things that used to not startle you?
I was out to eat with family, and a kid's balloon popped. I was on edge until we left.
Thank you for sharing with me. From your responses, I think how you are feeling is a result of PTSD from your deployment. It's nothing to be ashamed of, and there are many resources out there to help you. I think it's best to refer you to a specialist who will be able to discuss with you how to move on from here.